I will talk you through them and then I will do them and tell you my results. So the first one I'm going to do is capillary refill time. So I'm going to lift up her upper lip and I'm going to press my thumb on her gums for about 2 seconds, and then I'm going to lift off and count how long it takes for the color to go from the white that my thumb is going to leave back to pink. So it took just under 2 seconds, and the normal range is 1 to 2 seconds. So she is sitting right within normal range. If it takes more than 2 seconds, it means that she is likely a bit dehydrated, and that blood just isn't quite moving fast enough. So now we're going to look at her mucous membranes. So her mucous membranes are going to be her gums. You can also pull her eyelid down a bit. And that pink area that you get from the other side of her eyelid is also mucous membrane. And you can also, with mares, you can look within their vulva as well, and that works. Today we're just going to look at her gums. That is the most common way to look at them. So all I'm going to do is lift up her lip, look at the color of her gums. Oh man. Perfect. So her gums are nice and pink. That is totally normal and that is what we want. Now there are a few abnormalities that you can see in the mucous membranes. So the first one is going to be if the membranes are fiery red. That is going to indicate an inflammation or infection of some sort. If they're brick red or almost like a purpley blue bruised color, that means there is some sort of toxicity going on. If they are yellow, that means jaundice or some other type of liver kidney issue. And if they're pale, that means that there's some sort of shock, anemia, or even dehydration going on. So the next one, we're going to move right down to her neck, and we're going to do a skin pinch test, also known as a skin tint test. So all I'm going to do is I'm going to go right within the injectable triangle, which is right here, and I'm going to go at the end closest to her shoulder, and all I'm going to do is I'm going to pinch the skin up, I'm going to release it, and we're testing how long it takes for that skin to go back to normal. Lovely. That took about a second for it to go back to normal, just like the capillary refill time. We're looking for a range of 1 to 2 seconds. That is normal. If it was going to be above 2 seconds, that is within the abnormal range, and she is likely dehydrated. Now, I will point out that with an older horse, sometimes their skin isn't as pliable, it isn't as elastic, so it might naturally take longer and not necessarily mean dehydration. Okay, so the next two vital signs that we're going to focus on are going to be heart rate and pulse. So we're going to start with the pulse. The pulse can be found in two different locations. The maxillary artery, which is right on kind of the medial inside of her cheek. It feels like a wet noodle. It's pretty easy to feel. She's really good for feeling this because her veins pop out a bit. And then the second place that you can find it is the transverse facial artery, which is the one right here. You can see it better on other horses who don't have extra veins sticking out, but it is that vertical vein right there. So all I'm going to do is I'm going to find the maxillary artery. I'm going to find the maxillary artery, and I am going to gently put my finger there, and I am going to feel for those pulses of blood, and I'm going to count those. I'm going to count those for 15 seconds, and then I'm going to multiply multiply what number I get by 4 to get a total of beats per minute. Okay, so I got just about 7. So I'm going to do 7 times 4, and I'm getting 28. So the normal range that I'm looking for is 30 to 42. 28 is a little bit on the low side, nothing that I'm worried about. If her heart rate doesn't match that, then it's likely a human error on my part. But I'm currently not concerned since everything else so far has checked out. So for the heart rate, you do need one material. You need a stethoscope. So the place that you are going to look for the heart rate is going to be on the heart girth, just right behind the shoulder. And you kind of have to play around with the location of it. If you go too far back, you're going to get interference noise from the lungs and breathing. Too far to the right side, and you're just going to hear different things that aren't the heart rate. But I'm currently left side, right behind the heart girth is where I'm going to start, right behind the shoulder. Different. 9 times 4 is 36. My mama's. So 36 is within that normal 30 to 42 range. Now I did get a different number for her curls, so that is likely human error, and I can go back and do it again later. But both 36 and 28 are perfectly fine numbers. So I'm not worried about it right now because everything else is checked out. Now we are going to move on to respiratory rate. So for the respiratory rate, what I'm going to look at is her belly right here, right in front of her flanks. And you'll see it goes in and out as she breathes. So 1 in and out is 1 breath. And this one, I am going to set a timer for 30 seconds just because their breathing rate is so slow. To get the most accurate number, I'm going to do 30 seconds and then multiply the number I get by 2 to get a full minute. About 5, and it's hard when they move around. So 5 times 2, just for the sake of accuracy, is 10. So my normal breathing rate that I'm looking for is 6 to 16. It also can be taught, I believe, 12 to 20. It changed from one year to another. perfectly within range. If you go by the 12 to 20, it is a little low, but only by 2, and she was moving around, so there could have been some human error there. Overall, I'm not concerned. So the next vital sign that we're going to look at is gut sounds. Gut sounds are very important, especially if you have an inkling that your horse is colicking. This is a huge symptom for colic. So for gut sounds, you have 4 areas you're going to look at. You're going to look at the upper gut and the lower gut on both the left and the right side. And what I'm going to do, I'm going to put my ear to her belly. You can use a stethoscope for this. I like to just use my ear. So I'm going to put my ear in the upper quadrant and the lower quadrant of this side, and then I'm going to move to the other side and do the same thing. And what I'm going to look for this, for a normal horse, is intermittent gurgling. So I should hear gurgling within about 30 seconds. There it is. There it is on that side. I'm going to go to the other side real fast. That the whole time I had my hand on her in some way to just kind of keep track of where her body is moving. If she does want to move or if she does want to kick, having my hand on her body will help me detect that faster so I can move out of the way. So what I heard from her was just intermittent gurgling, so that's completely normal, nothing to be concerned about. There are a few types of sounds that are of concern. So the first one, if you hear absolutely nothing, just dead silence, that is going to be an indication of some sort of impaction, whether it's sand impaction or anything else, or like a twist, something that is completely halting the movement of her gut. So the next thing is going to be a rushing sound. If it sounds like a waterfall or running water, that is going to be an overactive gut, and that is also an issue. The last thing that you might hear is a pinging sound. It sounds kind of like flicking a tin pan. It'll sound hollow and very distinct. That means that she's got some gas going on, and it could possibly be gas colic. That, if it is the colic or not, is for the vet to decide, so it is something good to tell your vet. Last one that we have is temperature. So for this one, we do need materials. So the materials that we need are going to be petroleum jelly or any sort of lube is fine. And you need a thermometer. Today I'm using a digital thermometer, but once I finish with this, I will talk you guys through how to use a mercury thermometer as well, just in case that is what you want to use. So I have the thermometer and I have my lube. I'm not going to stick my thermometer in the lube and contaminate it. I am going to use my finger, get some lube, and put it on the tip of my thermometer. So I'm going to go to the side, and what I'm going to do, scoot. Thank you. So I'm going to grab her tail and I'm going to push it. Excuse me. I'm going to push it away from me so that it is not in my way. And then the thermometer is going to go in her rectum, and then I'm going to angle it. I can angle it away from me or towards me. I'm probably going to angle it towards myself. And that angling is just so that the tip of the thermometer is on the wall of her rectum and not against any sort of feces that might alter the temperature that we get. I'm just pressing the power button. I'm just going to hold it here until it beeps at me. That is the joy of digital thermometers. Perfect. So that read at 100.3 degrees Fahrenheit. That is a lovely number, actually. So the normal range for horses is 99.5 to 101.5. Most horses typically sit around the 100.4 degrees Fahrenheit. So she is at 100.3, which is just perfectly normal. Nothing to worry about there. It is a good thing to note that if your horse was just outside and it's super hot, or if they just got done with a really hard workout, something like that, their temperature might be elevated just naturally because of the heat outside and the work. So if you're worried about them, wait until they have cooled down and are at a resting state, and then retake the temperature to get the most accurate one. Also, if it is very cold out, their temperature might be sitting a bit lower than normal, and that is perfectly normal as well. It's just changing because of the temperature outside. So, for mercury thermometers are more accurate than digital thermometers, but not a lot of barns or clinics have them anymore. But if you were to have to use one, there would be one side that has the liquid mercury in it, and you want to flip it over so that side is down and all of the mercury goes to the bottom, and then you would insert it into their rectum and tilt it at an angle once again so that the tip of it is